This programme I'm talking about is the Master of Health Science in Nursing Studies or Professional Studies. It's a 3-year master's programme. The first phase of the programme is the Postgraduate Diploma. In that phase of the programme, there are 6 modules. So there are 2 of those that are core, so all students do advanced research skills and healthcare ethics. So they're the 2 core modules. And after that then, students can choose their other 4 modules from a suite of available modules. And there are up to 12 available optional modules on this programme. So for example, the optional modules would focus on particular elements or disciplines of healthcare. We would have quite a few modules that would be, for example, mental health care related. So those modules will be therapeutic communication, early interventions in first episode psychosis, assessing and managing eating disorders, assessment and management of people who have experienced self-harm. So they're the mental health focus modules. We also have other modules then that may be more focused on intellectual disability sector, just such as challenging behaviour and the management of challenging behaviour, and also autism module as well. Then we have other modules that more relate to healthcare practice in general, such as quality and healthcare management and the principles of healthcare management. People who apply for this programme are usually nurses working in the healthcare sector or professional health or social care workers working in health and social care. For example, we have had midwives, physiotherapists, for example, also qualifying for our programme as well. The programme is delivered on a part-time basis, so students have the opportunity to do the postgraduate diploma level of the programme over a 2 to 3 year period, and I suppose this is a unique feature of this programme. It allows for students to do those 6 modules, as I said, over a 2 to 3 year period, so they can go at quite a slow pace if they wish to do so by taking 1 module per semester over the 3 years, or if they choose to do it a little bit more quickly, they can take those 6 modules over a 2 year period. A lot of our students, I suppose, are working full-time because it's a part-time programme, and we'll have other life commitments. So we like to kind of promote our programme as one that will fit with a good life-work balance. And students then complete those 6 modules. They have the option then to graduate with a postgraduate diploma in nursing studies if they are nurses, or a postgraduate diploma in professional studies if they are health or social care professionals. And then at that point, if they choose to leave with a postgraduate diploma, they can complete at that stage. They also have then the other option of not exiting at that point and instead staying on for 1 more year. And in that year, then they undertake the master's element of the programme. And that involves 1 30-credit research module, research dissertation practicum, and they undertake a study in that time where they can really focus that study on a particular aspect of health or social care that they're particularly involved in or practicing in. Our modules are delivered currently in a blended format. In the main, students will come on campus to take their face-to-face lectures for their modules, and usually the module attendance for each one would be around 2 to 4 days, depending on the module. The minimum is 2, and then the maximum number of days for any one of our modules would be 4 attendance days. Some modules then may contain a blended learning element where students will do some work online in their own time in preparation for coming into a seminar day, or undertake work following a seminar day to kind of consolidate the learning from the attended session. Typically, nurses who undertake this programme will be well positioned to go on for management positions, and especially if they're focusing on modules like quality and healthcare management and principles of healthcare management, and if they're applying their dissertation to the management field as well. So they will be well placed to go on for positions such as Clinical Nurse Manager 1, Clinical Nurse Manager 2 or Clinical Nurse Manager 3. Other more advanced roles in nursing, such as Clinical Nurse Specialist, would demand that people applying for those programs would have master's level education, so it also puts them in a good position to go for those posts as clinical nurse specialists. Of course, they would need a certain amount of experience in that specialism, which would be separate to this program, but it would put them in a good position to on that pathway. For other then professional and social care workers, again, it would put them in a good position to go for management roles within health and social care, and also specialist roles if they have undertaken those specialist modules. So, for example, maybe eating disorder or early interventions with psychosis. So those type of modules would put people in a good position to go for specialist positions in relation to those particular areas of care.